Hi, my name's Gil Melmed. I'm here on behalf of the GI Health Foundation at Digestive Disease Week in Washington, D.C. And it's been quite a week in the world of IBD. There have been a lot of presentations so far. One theme that has really resonated with work that we've done as well has to do with the use of narcotics in patients with inflammatory bowel disease. So far, we've heard several presentations that have highlighted the, in my mind, staggering proportion of patients with inflammatory bowel disease that end up being treated with chronic narcotics. There have been administrative claims database-based studies that have demonstrated proportions of 15 to 30% of patients who may be receiving more than 2 or 3 or 4 prescriptions of narcotics in a 3-month period over 1 to 2 to 3 to even 4 years. And the amount of patients receiving this degree of narcotic therapy is significant and concerning. This has been shown not only in adults but also in children, as has been presented here at DDW. Our institution will be presenting data on Tuesday, which shows that for patients hospitalized at our own institution over a 3-month period, with 105 patients, about 70% were treated for pain with narcotics, and interestingly, through the course of their hospitalization, the narcotics didn't even help their pain, and many of them ended up being discharged while still on narcotics and received outpatient narcotic prescriptions. So what we're seeing is a significant increase over time in the use of narcotics. We're seeing persistence in the prescription of narcotics. We're seeing that many patients are transitioned from the hospital setting and being discharged with prescriptions for narcotics. And we're also learning, as we will be presenting, that even in the hospital, narcotics don't necessarily help the pain, but they're still being prescribed. I think what this tells us is that we have a significant problem on our hands. The nationwide epidemic that has been at the forefront of the news in the past couple of years has been affecting and directly relevant to our patients with inflammatory bowel disease. And we have our work cut out for us as healthcare providers, some of whom prescribe these medications for our patients, and many of whom have a role in educating our community about the potential harm and risk associated with chronic narcotic use, which has been associated with increased infections, readmissions to the hospital, and even mortality. So with the information that we've learned, this DDW, we look forward to future work, future publications that will continue to highlight the scope of the problem, but also to begin to suggest some solutions so that we can improve the quality of care that we provide for our patients. Thank you.